Well, good morning and welcome. Today we have representatives from Washington State Healthcare Authority with us to talk about the family planning only option. We have Andrea Estes, Emily Good, and Christina Bear. We are recording this episode or webinar. If you would like to share this with anybody who you think would benefit from this program, please feel free to share the link with them. We're going to send out an email today for everybody who registered, and we'll also have it up on our website later on this afternoon so you can help somebody out if they are interested. And with that, I'm going to, if you have any questions, please be sure to type them in the Q&A that is open and we can answer them on air. And with that, I'm going to hand that off to you, Andrea. Good morning.
Yeah, good morning. Thank you, Lisa, for helping us and to the Washington Hospitality Association for letting us present today. I came knocking on the door. Myself and my colleagues that are with you today are really here because we represent and kind of oversee some programs that have what we believe to be potential for kind of a different level of eligibility than Medicaid is generally perceived to have. So we think within the small business and the hospitality community particularly, that there could be a great opportunity to be able to access these programs for employees and for the benefit of the employer as well. So I will be talking about a program called Family Planning Only, and my colleagues will be talking about what would be pregnancy or after pregnancy coverage. So we are here from the Healthcare Authority. The Healthcare Authority is the largest purchaser of insurance in Washington State. We are here to talk particularly about programs within the Medicaid side of the work. It is sort of branded as Apple Health. But HCA also oversees the public employees and school-based employees healthcare coverage. So with that, I will start with, I'm going to share my screen. So my name, and I don't know if I actually said it, but Lisa did, so thanks. But my name is Andrea Estes. My title is Sexual and Reproductive Health Programs Innovation Manager. I work within a division called Clinical Quality and Care Transformation. I am not clinical by background, but work with a lot of clinical colleagues to help me implement this program. The Family Planning Only program has existed in Washington State for almost 2 decades, largely in part due to a federal 1115 waiver. So what makes family planning coverage unique is largely dependent on its eligibility. So I'll get into that in a bit. But family planning only is considered a limited benefit. So it only covers family planning services for those who otherwise don't qualify for Apple Health or Medicaid or are seeking confidential care. When it comes to some of the key differences for eligibility, income is one of those primary factors. So for Apple Health, the income threshold is often at 138% of federal poverty line. Now, for family planning only, the income threshold is 260%, which, and this is sort of a rough estimate, but people, what is 260% of federal poverty line? Well, if you're working full-time, 40 hours a week, throughout the entire month, it is about $20 an hour. So hopefully that gives you a better perspective on who could be eligible for utilizing this program. Under federal, generally under federally eligible programs, immigration status makes you ineligible, but that is not the case for our program because we also have a state-only payment source. So it is the same program, but your immigration status does not make you ineligible. This program also agrees for those who are seeking confidential coverage. And so, for example, that would include those who are on their parents' insurance or those who are experiencing domestic violence. So what is covered under family planning only as a limited benefit? Again, it's family planning services. You can receive a comprehensive family planning visit annually with all related follow-up visits. It covers counseling and education, risk reduction. It covers education and supplies around a broad spectrum of FDA approved contraceptives, and this includes both prescription and over-the-counter methods. It also covers permanent methods, tubal ligation, or more commonly known as tubes tied or vasectomies. And I will note that gender does not matter in terms of who's eligible for the program. We have actually seen more men accessing this program as of late too. Pregnancy testing and cervical cancer screening when it's appropriate, STI, so sexually transmitted infection testing and treatment, and a few vaccines are also covered. So how to apply? I think generally we will point folks to the Washington Health Plan Finder to see if they're eligible for more comprehensive coverage. But if you are not eligible and you would like to apply for family planning only, we have an application that is housed on our website. What I've also been told is that one of the easiest ways to apply is just a call. So we have customer service folks or those who manage the application process. And so you would call in at this number with this extension, and interpreters are available if needed. In terms of the provider network, and we heard this was a question that came from the Hospitality Association community, like who can I, receive services through? So for family planning only, and I don't know if folks, if this is more of a nuance within like the medical community, but maybe not, maybe it's broader. But there used to be a restriction on certain types of clinics. They were called like family planning clinics or STI clinics. But the family planning only benefit, that changed in 2019. So anyone who has this coverage can go to any Apple Health enrolled provider that offers family planning services. And I am going to demonstrate our find a provider tool that we think is helpful. And I know that we have people who are invested in trying to make it a really useful and applicable tool for those seeking looking for providers that are enrolled as Apple Health providers. But I do want to also note that pharmacies are an incredible asset and in terms of the providers and access for family planning methods, especially for those who are perhaps looking for over-the-counter methods. Some things that is unique though, if you are to bring your, you will have like an Apple Health card once you go through enrollment and approval. The purchase of any of these OTC or over-the-counter products has to be done at the pharmacy counter. So not at the retail counter, but at the pharmacy point of sale. So that's just an important note for folks to know. So this is an example of our find a provider. So provider one, find a provider tool. So for example, we are in Spokane. And if I want to find pharmacy that might be nearby, this is essentially how the tool works. So we hope this is helpful for folks to get a sense of where they are able to access providers that are currently enrolled Apple Health providers. And I don't see any hands or any questions quite yet, but I know Lisa will chime in if need be. So for the family planning only program, we want to make sure that we're accessible. We know that sometimes these coverage options, there can be changes, there can be complexities. And so what we have offered up within the last couple of years, and we'll continue to do so, is something called office hours. We host these, I particularly host these office hours twice a year. Often we have providers that come and have technical questions, say on billing processes. But these are not closed forums. So we have had others show up, maybe clients, maybe assisters, advocates. So if you have a question that is specific to family planning only, we do encourage folks to try to, you can email us, you can call us, or show up at the office hours. We do ask for folks to register in advance and provide us your questions so that we can have all the appropriate people from the healthcare authority available so that we can, efficiently answer questions. Some other really useful tools, and this PowerPoint presentation will go to Lisa so that she can share it with the association's community more broadly, and you'll get the links. But we also have a customer service center that we called Max. Max also is very accessible through either phone or email for any questions that clients might have, or prospective clients. And then I think we also have what's called a community support specialist list. And this is, I would say, something that if individuals within your staff are maybe seeking, greater support and want to find out what more could be offered to them through the Healthcare Authority or Apple Health programs, that the community support specialists would be really useful contacts. Again, these links will be shared in the PowerPoint. On the family planning only webpage, we also have brochures. And if any of your businesses would like printouts of those brochures, please email me directly. And I would be happy to have those printed and sent to you. We do offer brochures in, I believe, 15 different languages. So you'll just want to let me know which ones, how many, and which languages. Thank you for your time, and I'm going to hand it over to my colleagues, Christina and Emily, if I don't have any questions.
All right. Oops. Let me share my screen here. Okay. So as Andrea said, my name is Christina. I'm a policy manager with Eligibility, Policy, Innovation, and Community Sports, otherwise sports support, sorry, otherwise known as EPICS here within the Healthcare Authority. Emily, do you want to introduce yourself?
Sure. I am Emily Good, and I work with Christina, and I am an eligibility policy manager, and I also work with EPICS. I'm happy to be here.
So today we're going to go into a little bit more of the after pregnancy coverage. Pregnancy coverage is under Apple Health, and that has a little bit different criteria. Generally, speaking, people who need family planning services, other things, will be doing the automatic from the pregnancy program into the after pregnancy coverage program. So some of the things we're going to talk about today is after pregnancy coverage, eligibility, the covered services, our educational campaign highlights, the impacts of APC or after pregnancy coverage, and providing just some additional resources. So some of the background, so prior to the expansion of postpartum coverage in June of 2022, pregnant people on Apple Health automatically received 60 days postpartum coverage the month following after their pregnancy ended. Then they would transition into that 10 months of family planning only. With the transition to the original from the 60 days of after pregnancy coverage to the family planning, it provided only a limited amount of coverage for the remaining 10 months. So the goal of this was to, definitely provide better coverage for people after pregnancies have ended. So with some of that, we had postpartum extensions. And so in 2021, Senate Bill 5068 was passed. And this extended the postpartum coverage from 60 days to a full 12 months after a pregnancy has ended. And then the new program, of course, we named that After Pregnancy Coverage, or APC, and we implemented that in June of 2022. In March of 2024, Senate Bill 5580 was passed. And what that did was allow an additional 5 days of the hospitalization stay for the birth parent. And it also increased the federal poverty level to 210% from 193% for all pregnancy and after pregnancy Medicaid programs as of November 1st of 2024, which was really good because we're actually seeing a little bit of an increase in those programs now due to that higher income level. So some of the eligibility requirements for someone who is already active on Apple Health, a pregnant individual who is already active on the Apple Health program will automatically transition to the after pregnancy coverage for 12 months after the pregnancy ends if there is an estimated due date reported during their pregnancy. After pregnancy coverage will begin the first day of the following month. The pregnancy ends regardless of any pregnancy outcome. So no matter how that pregnancy has ended, we will still allot that full 12 months of coverage for our individuals who are currently on Apple Health. And coverage is for the 12 months, regardless of a change in income or household size. Once you're eligible for that full 12 months, you're eligible. So there's some more information that is on our website under the hca.wa.gov/APC. So for those people who are new to Apple Health, so people who are not active on Apple Health coverage, they still can apply for after pregnancy coverage, but they must meet the following eligibility requirements. So they must have had a pregnancy end within 12 months when they apply. They must reside in Washington State. They have to have accountable income at or below 210% of the federal poverty level, and they must not be active in any other Apple Health program. For these programs, immigration status does not apply, and coverage begins the month the individual applies and is found eligible. So with some of the income standards, as of November 1st, 2024, as we stated, the income standard increased to 210% of the federal poverty level. And so the chart here shows the different household sizes and the gross income. So income prior to taxes and deductions, anything that, can come out for you. And it includes our 5% disregard. So it's a little bit higher than the standard poverty level limit by that 5%. So the other thing to keep in mind is with these income limits, so for a single person, obviously that would be $2,698. The thing to keep in mind, and we can't really break it down into an hourly wage, is there's several deductions that you might be eligible for. And so there are calculators located, 3 different calculators located within our website. And that will be able to help you. You can input your hourly wage and different things there, or see what you might qualify for because it asks specific questions. So some covered services, after pregnancy coverage is a comprehensive coverage that mirrors services during pregnancy that include but are not limited to physical health. So your primary care doctors, any specialty care, urgent care, emergency department, things like that. Behavioral health, so mental health and substance use disorder treatment services. Oral health, so all dental services that are covered by Medicaid. And hospital services for inpatient and outpatient. And there is also a link to be able to go to in order to view exactly what is covered with that. And I'm going to pass this on to Emily, and she can talk about some different educational highlights that we've had.
All right. If we go to the next screen. So when the APC program was implemented, HCA utilized a budget of $30,000 to reach the intended audiences through social media, radio, community-based outreach, and some publications. Outreach efforts have continued through November 2024 to educate Washingtonians on increasing the federal poverty level requirement from the 193% to the 210% for all Medicaid pregnancy-related programs as discussed previously. Next page, please. A part of the outreach was GovDelivery, and this was used to get the word out about the APC program. It was sent to providers of family planning, tribal and rural health clinics, and behavioral health clinics as well. Next slide. We also updated our HCA website with a page dedicated to the APC program. And there are flyers available in 15 different languages on our HCA website. Also, we have posters if interested. They are also located on our HCA website and do come in the 15 different languages as well. And we also have a social media toolkit that you can request if you're interested in the social media aspect of things. And if you are interested, you can email the request to social@hca.wa.gov. And in our implementation efforts, we used radio ads in both English and Spanish to get the APC information out to our eligible population. We also had interviews on a couple of occasions on our Spanish-speaking radio stations, and that was getting the word out to our Spanish-speaking population. Okay. And now we're going to take a look at the impacts of the after pregnancy coverage program. So there is currently an evaluation of the APC program in process. Through this process, a review of eligibility, service utilization, and cost are being analyzed. Early findings suggest that the eligible population has a lower utilization of services rate than anticipated. Through the evaluation process, we have found a couple of areas that HCA would like to address, and one is a request for wide partnership amongst all that work with or support pregnant individuals to get the word out about the APC program. We would also like to encourage clients to report their estimated due date and or the end of pregnancy date to ensure a seamless transition from the pregnancy program to the APC coverage program. Okay, next slide. And with that, we have some web resources for you. We talked about after pregnancy coverage and including the flyers and posters that are available in the 15 languages. You can find those at hca.wa.gov/APC. There's also the pregnant individuals eligibility page. And that's at hca.wa.gov/Apple Health Pregnant Individuals. And last but not least, there's an HCA stakeholder training and education link, and that's at hca.wa.gov/stakeholder training.
Go ahead, Emily.
Oh, go ahead, Christina.
That's going to say, and thank you. If there's any questions, you can feel free to definitely email myself or Emily directly if needed, but also visiting our web pages as well.
All right. Thank you, all three of you. I have a question for you. Is there any kind of waiting list or time to wait in order from start to finish to sign up and get on this program? Or either of these programs?
I'll take family planning only first. So first off, you can apply at any time throughout the year. It's not impacted by, say, like open enrollment periods. And I believe our Epics, tell me if this is about right, but our applications are processed relatively quickly. And so whenever I'm kind of in touch with those who are doing the applications, they process them within a couple of weeks, it feels like. I think by law, they have to do it within 45 days. But usually our applications team processes those much quicker than that. And a little bit to reinforce what Christina had also mentioned, for the month that you apply in, and whenever the decision is made on your application getting approved, your coverage is essentially retroactively starts the beginning of the month you applied. I think that's helpful for folks if if things feel a little bit more urgent, or if they are walking into a clinic. Christina, would you add anything or clarify anything?
No, it's the same way with Health Plan Finder, with the applications for pregnancy coverage and after pregnancy coverage. You will know whether you qualify unless there's some information that is needed. You would know pretty much right away, kind of thing. So that's kind of the nice part about the Health Plan Finder. Family planning only, obviously, you have that different application process. But with the after pregnancy and pregnancy coverage, the only difference is if you're going to apply during a pregnancy, then you will automatically enroll into that after health pregnancy health coverage once that is ended. So once you report your due date or report the pregnancy ending for whatever reason, then it will roll starting the first of the following month, whenever that is. So say it was November 15th that you had your pregnancy end, your coverage for after pregnancy would begin December 1st and would continue for 12 months after that. So with if you're just applying for Apple Health after pregnancy coverage only, you just have had to have a pregnancy end within 12 months. So say you were 3 months after a pregnancy has ended, you apply for Apple Health after pregnancy coverage, you're approved, it would go into effect the month of application if you're eligible, and then it would continue. So if you already had the 3 months that you had in a pregnancy in, you'd have 9 months of continuous coverage after that to be able to support those efforts in maintaining healthy parents.
We have a question from the audience. On the webpage, it says that the one of the programs is full. Is that either of these two programs?
No. That's a reference to what's called Apple Health Expansion. So that is the Washington State Comprehensive Coverage Expansion Program for those who are otherwise ineligible for a federal program due to immigrant status.
All right. Well, thank you, all three of you, so much. This is great information. We hope we can share that with not only our members, but our members' employees and their teams. Hopefully they can get the word out about this. We do have another question that popped up. Oh, it's just thank you for the clarification. Thank you all so much. We will have this up on our website later on today. And if you have registered for this, we will send it to your inbox. So go ahead and check your email later on today, and you can find the link and share it. So thank you all so much, and have a great day.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.